Good morning, good afternoon, and good evening. Welcome to the 911th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you. Today, our guest is Dr.Sadaf Ulde, BHMS Fellowship in Psychiatry, Director, Health Satya Foundation and Binary Infusion Teaching Faculty at the Others of Mumbai with 13 years of experience, and the subject is Scope and Use of Mother Tinctures in Homeopathy Part 2. We know the role of Mother Tinctures in homeopathy and how it is helpful in making or giving some sort of solace to the suffering persons. Before we arriving a constitutional prescription or a deep active medicine, definitely these medicines will help wonderfully. And especially in cases where the patient in such a situation that only palliation is possible, that condition also, they are very helpful, very instrumental in restoring the healthy condition of the person. So on behalf of IFPH, I am welcoming doctor. You can have the platform for the next 45 minutes. It's all to you.
Thank you. Thank you, Dr. Manoj, for a lovely welcome. And thank you each and everyone for having me here. So before I go ahead with my today's presentation, firstly, I'd like to apologize. I'm having a little bad effect of cold winds over here. I'm having a bad nasal bleed, so my voice may be a little low. I hope you excuse me for that. And I'll start with my today's topic. Some other tinctures in homeopathy. Like last time, we already studied some of the factors when and where do we need to give homeopathy. In the last session of mine, and very briefly, if I have to conclude my last session and start with the new session, so that it's a reminder for the old people who attended and those who have not attended get a little bit overview of it. So you give mother tinctures in homeopathy, not like a GP practice. Okay. That's the first rule. I think in homeopathy, out of everything that is available, whether it is 12 tissue remedies, whether it is mother tinctures, whether it's rescue remedy, whether it's folic rest remedies, you give them only when they follow the law of individualization. Okay. When you have done justice to your case by taking a complete history and you have understood the whole effect of the remedy. It is never a prescription like you have so and so condition, so you are taking so and so mother tincture. Renal stone equal to Berberis aquifolium. It's the biggest valid practice in homeopathy that people do. That's why most of the time, many teachers, when we talk about mother tinctures, they say, no mother tinctures, no palliation, no suppression. But this is what I learned with some of my teachers is that the problem is not mother tinctures. Problem is when we are using mother tinctures like how you use an allopathic medicine. I remember reading one of the aphorism of Dr. Hahnemann where he said that, if you practice homeopathy like allopathy, you're bound to fail. Okay. So don't do that. If you have to prescribe mother tinctures, number one, where is the patient at the level of experience? Okay. If the experience and if the issue is more at a pathophysiological level, okay, and you need a solution there, you can use mother tinctures, but it's not a very uncalculated or unsystematic or unscientific approach of giving a mother tincture. Even before giving a mother tincture, you will have to see what are the signs, what are the symptoms of the medicine, and which mother tincture is very closely related, and then prescribe. Similarly, you can do with whether it's 12 tissue salts or whether it's bath flower remedies. The idea is you need to understand what is the symptomatology and when you'll prescribe what. Like for menstrual disorders itself, you have Janosia ashoka, you have Gossypium herbaceum. But when are you going to use Janosia? When are you going to use Gossypium? How do you individualize this drug and then prescribe this remedy? So once you have individualized the case, and then you have come to one of these mother tinctures, you will have more beneficial than just randomly giving some remedy. Okay. So if you go ahead and you find yourself stuck with a case, going ahead, you have taken a well defined case and you're stuck somewhere in the case, you can use these tinctures, but you use it in a very carefully navigated way. So you definitely will have results along with your constitutional remedy. Your constitutional remedies are no excuse to use of mother tinctures. Unless and until you see, I remember one case, very old case of mine, where after taking the case, I got a feeling of the whole case. The main sensitivity was coming around Malville's family. Okay. But none of the remedies like chocolate or Telia were exactly fitting in for the patient of mine. I couldn't really go that deep to differentiate what is happening. So, in that case, what I did, I read all the remedies in Malva's family who have specific affinity for uterine issues. And when I read the remedies, out of them, I got one remedy which indicated me, which has a mind, the whole uterine symptom, the whole era of uterine symptom. And because I was not able to collect a lot of symptomatology, but I had few state which were giving me a hint of Malville's, I gave this remedy, which we use as a mother tincture, in a very low potency, and it helped the case of PCOD. Okay, so the thing is, if you derive from a mother tincture, you think that mother tincture will be A is equal to B. Like if I'm attending a mother tincture lecture, I will know 10 mother tinctures that I have to just prescribe for this disease condition. Then you will not obviously benefit much from this lecture, because that's not what I want to promote, because that's not what Hahnemann promoted. And that will not individualize the case, and that is not the philosophy of homeopathy, and that's not the practice of homeopathy. Okay, so I'll just give a case example directly. 55 years female complained of diabetes mellitus. Okay, known case of diabetic mellitus. She is having diabetes since 20 years. Okay, and the sugar levels recently have begun to fluctuate from 400 to 500 milligram per DL. There was sudden tingling numbness in hands and legs, lot of burning sensation she felt in her hands and legs, weakness. She will say, "Doctor, it seems as if I'm getting old very quickly. This is very, I don't know what is happening. See my skin," she will say, "See my skin, how it has become. See my hand, how weak I have become." So there was this general feeling that she will feel that she's become very weak. She was extremely tired, very fatigued. Little work and she will get fatigued easily. She had this constant mouth taste which was bitter. Urine showed excess presence of sugar in urine. The color of the urine was white, but it was copious. She had to pass it several times at the night. In the urine test, random urine test, specific gravity was high and there was large amount of sugar that was found in urine. Patient was increased in weakness and tiredness. History of medication taken. Allopathically, she was taking tablets, which was a combination of sitagliptin and metformin. Insulin was started by her diabetologist, diabetologist, which was 12 units before lunch and before dinner. Okay. And the diabetologist said that if this doesn't come down in some time, I'm going to increase the dose further because the amount of blood sugar is not good. So, what was the effect of this illness on this patient? So, when this patient came to me, she was in an extreme terrorized condition. She was very scared seeing that 400, 500. Husband said the day I checked her first time and she saw that 400, 500 number, she's in extreme panic since then. You know, she literally fainted, and there was a big, huge thing at my home. My son came running from work because she fainted seeing the number, and she was very scared. And since then, she has not allowed her son to go to work, her husband, and then she will continuously call the doctor that was her treating doctor. whatever whatever you say, then she says, doctor, whatever you say I will follow, but please get me better. I don't want this insulin for a long time. I'm very scared. And she kept inquiring about, do you think my kidneys are damaged? Do you think my liver is damaged? Do you think my stomach is damaged? Do you think I'm going to die soon? Do you think my legs will be cutting off? What will happen next? What worse will happen? Then what will if this happens, and what will that happen? So there were a lot of questions that was coming up, and which gave me an idea that she's in a panic condition. She had a family history of diabetes. Her mother had died due to complication of diabetes. And seeing this figure, she's like, do you think I'm also going to die soon like my mother? She was extremely terrified. Her hands and feet will be cold, and she will wake up at night extremely terrified. Will just go and hug her husband, or will go out in the next bedroom and just will cling to her son and hold them tightly. Or she will not go to sleep. Whole night she will sit on the prayer mat praying, reading her tasbih, reading her Quran. So every whole night this was going on. She was extremely in a panic situation. Since she had heard this, she was extremely restless, very anxious, very fearful, very frightful. Dreams, very scary dreams she had, something like dark nights, people in white clothes, all alone, dead bodies all around, extreme fright, and she will wake up from this fright and she cannot sleep back. So this was more or less the case. So what do we do next? Very simple for a homeopath to understand clinging of this female. Okay, clinging to person, clinging to awakened, terrified, and clings to those near, light desire for. And a very simple remedy that comes up in this situation is stramonium 1M. And I prescribed stramonium 1M BD for 2 days, and I waited, and I asked her to come keep taking the readings and come down after 15 days. After 15 days, the anxiety, the fear, the general health improved. But the 15-day scale of a blood sugar levels were almost the same like before. So I wanted to give our remedy a full chance. So I repeated the dose. Okay, this time I repeated in plussing method. And we all know plussing method is you ask 4 globules to mix it up in half cup of water. And then patient takes 1 teaspoon depending upon how you look at the situation, every 3 hours, 1 hour, half an hour if it's an acute condition. That is left on the physician's discretion based on the intensity frequency of the patient. So in this case, I gave a stramonium plusing method every day once. And the next follow-up, sugar test was done. Again, it was the same. I had ordered for a random urine sugar test, which was also the same. The sugar level continued to remain high despite insulin, all other medicines that she was taking, and our medicine that was included. But there was definitely a change after the remedy. Like, she was not that frightful. She was sleeping better. She was eating better. Everything was good. But the continued high sugar was a concern. So, what do we do next? Was something that was going on in my mind. The remedy definitely had helped the patient. She was doing well. But somewhere the pathology was not moving. And we, in this situation with so high sugar levels, you do not have time for asking and saying that, okay, let's wait for some time. Give it 6 months, give it a year, it will come down. With this high level, there's often a fear of straining the organs, right? To have some major damages. Worst come worst, the allopaths will increase the dosage of insulin when that is not what the patient was wanting for, right? And we want to relieve this patient from this agony of high sugar level. So her main concern was get my sugar levels in control somehow. Now, what do we do next as a homeopathic physician? How do we react to it? Do we just wait and watch? Do we proactively do something? Or we tell the patient to increase the insulin doses? We have always 2-3 options in front of us. So I thought I will go back to a physical complaints. I will go back to a pathophysiological aspect. Right now, her mind is quite stable. The anxiety is gone, the clinging is gone, the waking up at night terrified is gone. She's sleeping well, eating well, following her routine well. Okay? So, somewhere, stramonium state is not there. That's what I understood. So, stramonium has done what it was supposed to do. That's exactly what Bonnet has said when he spoke about different layers of remedies and to understand in pathological condition. Okay, he said treating a very deep pathology, the chronic pathologies like tumors, diabetes, or any such pathologies which are difficult, it's like you're peeling the layer of onion. You peel off one layer after the other. And at every step, a work is required. Okay. So what work do you do here? So stramonium definitely helped by removing this layer of this anxiety, panic, fright. But now there was something different that's still remaining. And in future, maybe something else will be there. And we have to address it as time and again when it comes. Okay. And that's how you clear the block, you clear the road, and the patient feels better as far as possible. So in this case, I said, let's understand what's happening pathophysiologically. How is diabetes affecting her body? Okay, what impact diabetes at this high range can have on the body? And what is it that's specific for her? So number one, she said, that her urine is showing constantly the raised sugar levels. Okay, we were constantly seeing that there's high sugar levels in the urine. There was a fatigue, loss of weight. Okay, she said she's feeling and she's going weaker And you see neuritis-like symptoms developing. She says tingling numbness around her feet. So now I think to myself, in diabetes, a lot of things can happen. When this high level of diabetes is there, how do I individualize taking the common symptoms? That's what I think in such cases. So in diabetes, when this level is so high, what all things can happen? Somebody can form a skin trouble. Somebody can form urine issues. Somebody can have joint issues. Somebody can have kidney issues. Somebody can have a very deep-seated problem. Somebody can have infections that are not healing, a non-healing wound, right? We know what happens is during high diabetes, the peripheral neuropathy also develops. That's why many patients complain about the tingling numbness, the heaviness under the feet because of the high diabetes, the peripheral neuropathy when it develops. So now I have to give a remedy which can help me achieve these things. Reduce the excessive sugar in the urine, fatigue, okay, weakness and weight loss due to diabetes. So I'm trying to figure out the remedy, and I know I have to give a tincture which can help this. Okay, these things are my concern, and the burning sensations he spoke about. So I have to consider this in my totality. Okay, this is my thinking process, nothing else. Right now, I'm not thinking about what mind is she, what state is she, what about the fear, what about the. No, I'm just focusing on this because today my patient. So I remember one of my teachers saying, always see what is the present predominant state of the patient. Do not linger in the past state so much. Okay, see at the present predominating symptom and treat that first. Let that layer go off and then see what comes up next and then prescribe accordingly. Okay, so I said, fine, I'll just take this part of her and see what is coming up. Along with the constitutional remedy, can I add something to it? Or do I give it standalone? That will decide later. Okay, so I have the symptoms now with me. What do I do next? I gave her Gymnema sylvester mother tincture. Okay, 4 drops before lunch and dinner, and stramonium 0/5 OD at night. I thought it's safe to continue the constitutional medicine because definitely the constitutional medicine has acted and she was doing better with it. So I didn't want it to disrupt the whole thing. What do I learn from this case? Okay, this is what happened over a period of 3 months. Urine sugar absent, fasting blood sugar level went up to 110, PP went up to 150. Obviously, I don't expect her to miraculously come down to 5 or 6. But over a period of 1 month, 3 months, her HbA1c came up to 7, which was otherwise 11, 12, 12.5, 13. It came down to 7. Very recently, I had a talk with this patient, and her HbA1c has come to 5.6. Okay. No doubt, her allopathic medicine are continuing. We cannot stop it together. But over a period of time, insulins have been stopped, and a diabetologist has moved her to only oral hypoglycemic medicines. So now there are 2 questions that come to our mind as a homeopath and as a person who's taking homeopathy or who wishes to take homeopathy, that do after taking homeopathy, I stop my allopathic medicines very quickly? Or do I continue? And if I continue, how do I know that your medicine is acting or the allopathic medicine is acting? There are 2-3 questions here that come to your mind. So, number one, allopathy will never help you with your terrors of night. Allopathy will not help you with your sleeping issues, okay, unless and until they give you an antidepressant or a anti-anxiety drug, okay. This is where homeopathy gives you a general state of well-being, okay. And in this case, especially if you are already on allopathic medicine and still your levels are high, that means allopathy was as it is not benefiting you, okay. So it is very safe for us to say stop the allopathic medicines that you are taking, but it may create even more panic amongst the patient. So the safest option for a homeopath is to ask the patient to continue whatever treatment they are taking. Okay, do not add on to the terror of what they are facing. That's what I feel. There may be doctors who beg to differ on it, but at least in conditions like diabetes, um, cardiac issues, and blood pressure, I will not recommend to immediately stop any allopathic medicine, because the values that you see are despite the fact they are on certain chemical based substance. Imagine if you remove that substance from background, what will happen? There will be a catastrophe condition in the body. So you never do that you directly remove the allopathic medicines from background. Okay, you give it a time, give it certain time. And in diabetes, what max you can offer is, if it's a very old case of diabetes, a very 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 chronic old draggy case of a diabetes, you can bring down the patient to a very minimum dosage of allopathic. If it's a very fresh case like a pre-diabetic or a very initial stage of diabetes, you can almost reverse diabetes. You have to understand which stage the patient is. A pre-diabetic, initial stages of diabetes, like recently it has gone above 5.5 or 6, 6.5, then you can bring this patient back, even if it is full-blown diabetes. You can bring this patient. If it's a fresh virgin case, you can bring it down. Along with the patient's willingness of doing lifestyle changes. Okay, if the both is combined, in very initial stages you can do that. But this late cases, like when old people come in 60s 70s with a history of 20 30 years of diabetes, do not promise them to reverse their diabetes in 6 months 1 year. It's not that easy. They have already developed peripheral neuropathies, they have some or the other eye issue, some or the other. Yeah, but what you can offer them is to have a very good lifestyle. Okay, Re- reduce the impact of the blood sugar, fluctuating blood sugar level on the body, and also the impact of the allopathic medicines on the body. After sometimes the oral hypoglycemic just don't work on the patient. Like case like this, after some time, even insulin in a very mild dose will not work. She couldn't survive her life without heavy doses of insulin with increased doses, if it was not homeopathy in background. They keep progressing if they are only on allopathy, and also if there's no lifestyle changes in background. Okay, so over a period of 6 months, if her insulin has stopped and she could go back to oral hypoglycemic, that it in itself is a good reward for us. Because otherwise, if allopathic medicine is left alone, this can never happen. Okay, mostly they keep increasing the dose of insulin, and it's always an uphill than the downhill with the allopathic medicine that goes on. So what do we learn from this? How do we apply mother tinctures again? So it is very safe to think about diabetes, Caesium chambolanum. I see it's like the most favorite remedy of every homeopath when it comes to diabetes. Now, by default, people will give Caesium jambolanum. Whether take a full history, not take a full history, they will end up giving Caesium jambolanum. I know so many of my patients who bring to the clinic, doctor, this big bottle they bring, doctor, I have been advised this by one of the doctors somewhere in, and I'm taking this every day. And they say this will cure diabetes. So it will. Obviously, Caesium jambolanum is a good diabetic remedy. But it will only cure when it is indicated. It will not otherwise cure. Now, in this case, I use Gymnema sylvester. Now, it is very interesting remedy. Now, Gymnema sylvester as a remedy in itself, okay, is the remedy which is known to produce sugar. It increases the sugar levels in the urine. Okay, so the tincture of these leaves are very, very important. Okay, if you take Tarkas Karni's diabetes repertory, okay, in that he mentions every case of numbness, neuritis, tingling, along with burning sensation, he uses Gymnema sylvester as a remedy. Murphy writes that when the person is unable to, when the taste is altered, another indication of Gymnema sylvester is when the taste is altered. Everything that the patient tastes is not sweet. Then he will think of the remedy like Gymnema sylvester. Okay, so the whole composition of this is very much, it has gymnemic acid as the active principle. Okay, so these remedy in therapeutically you give when you see there is increase of urine sugar level. Okay, in Ghosh's book Drug of Hindustan, he writes, when you see that the blood in urine of sugar of patient has shown no differences, you start with this remedy. Okay, when the muscles have been completely relaxed, it feels very relaxed. Okay, urine is loaded with sugar and patient is passing a lot of quantity of urine and is very weak. Specific gravity of the urine is very high. Patient is extremely going weak, and if the patient with diabetes, if it's a male patient or female patient, if it's a concern for them, in this case the patient didn't talk about it, but many times people do come to us that due to diabetes my my energy or my libido has gone down. You can think of Gymnema sylvester as a mother tincture. So these are the basic indication for Gymnema sylvester. Then when do I give Caesium jambolanum, which is my favorite remedy, right? Most of you all must be thinking, we have been giving this remedy so much. That is also a remedy for increase in blood sugar, right? So this is the remedy you give. Caesium jambolanum, you give when you suddenly see rashes and patient complains, I have a lot of itching due to and there is a high sugar level. You examine the patient and upper body of the patient, a small red pimple like eruption, and there's a lot of violent itch. Thirst is high, and there is weakness, and there is emaciation. Then you think of Caesium jambolanum as a mother tincture. Not because it is diabetes, you will give Cesium jamolanum. That's the very wrong practice you can do. Okay, so very specific weakness. Then there is a remedy, Abroma augusta, which is also another good remedy for, I'm sorry, Abroma augusta is another good remedy for diabetes. Now, when do you give Abroma augusta as a remedy? Patient comes to you with full-blown diabetes, high level of albumin, debility, vertigo, sleeplessness, weakness of vision. And like bryonia, he says, I constantly feel dryness of mouth, dryness of tongue, dryness of throat, and I need to continuously drink water. Constipated like bryonia. That's the time you can think of Abroma augusta as the remedy. Irritability is there along with it. Okay, they feel restless, indifferent, anxiety, absent-mindedness, dislike any activity or work. Then that is an indication for Abroma augusta as a remedy. There's one more interesting remedy for diabetes, and that's Syphilandra indica. Okay, you can use this remedy also for your diabetic patients. Now, in this, the indication is a bit like gymnema. Okay, the only difference I think in Syphilandra and gymnema is I'm sorry. I think the only difference between the Syphilandra indica and Gymnema sylvester is that both these remedies, the burning is of Gymnema is absent in Syphilandra. Okay, so this is how you differentiate the mother tinctures and you take a step with mother tinctures, not blankly prescribe a remedy. Okay, blankly prescription of remedies may give you a lot of hindrance. You may lose hope in homeopathy, and okay, this is not working. Okay, that will then be a problem. And it's not just Cesium jamolanum. Sometimes there are also remedies like uranum nitricum in a very low potency when there's extreme exhaustion. Patient is completely, there's loss of weight, there is lots of um, complete exhausted state, like that. The patient is lying, has no energy at all. That's the time you use uranum nitricum as in a very low potency like 3C 6C for diabetes mellitus. Okay, so this is how you can go on with your mother tinctures. And this was just with diabetes. There are several other conditions also where you have to differentiate that when will I use this mother tincture from the other mother tincture. Okay, and that will help you in your practice. I think Dr. Manoj is looking at me, that time is getting over.
No, Doctor, time is getting not. That's the problem. You are really struggling, and I think we shall conclude here. Then we can have the discussion. You are really coughing, sneezing, and struggling to complete the proceed. Is no doubt. No, don't worry about Doctor that. We can have a discussion, a nice presentation, and in fact, it did force us to think. A lot of concoction is done by Dr. during this session, because how to use this tincture, there is also have some indications. Without the indication, there is no homeopathy. That's the most fundamental thing. A nice discussion and nice presentation, and the confidence level is very high. Unfortunately, you are not well today. And now
Yeah.
it's time for discussion. And who will be the first person to raise hand? Of course, it is our Sridhar Group sir. Yes, sir, please. Please unmute, sir. Yeah. You are muted, sir. Please unmute.
Yes, Madam, it was a wonderful session. I to appreciate, I to give Jimna Master and such mother tinctures, not only for this, several times pathological condition, if it may come, it will control. But what you said, it is correct. Immediately you must not stop that. As a patient, as a doctor also, I experienced this thing in my life several times.
Yeah.
And so I am a last 33 years, I am a diabetes patient. I faced all these problems and I overcome all these things. That is why I appreciate you. But I like to ask one question because you are not feeling well, so I don't want to ask so many questions.
No, you can go ahead. No problem. Please.
And what about the diet? About
Yes,
and
yes,
exercise?
I do. I do ask patient to take regular home-based diet, okay, and to involve any physical activity of their choice. If a patient is above 55, 60, I ask them to do minimum 30 minutes of walk. So and in diet, I ask them to take a good breakfast, okay, a nice, well home cooked breakfast, followed by some fruits mid afternoon, okay. Then afternoon lunch, they can have whatever they want, like dal, chapati, roti, vegetable. If a person is a non-vegetarian, one or two pieces of non-veg is okay, okay. But towards the evening, I ask them to reduce on taking anything that has sugar, fruits, vegetables, okay. As far as possible, I ask them to have salads of cucumber, okay, cucumber, tomato, lettuce, the mixture of the good veggies and soup, so that they keep a maintained good. Mostly the sugar level should not spike and it should not go down also, we have to make sure. So I suggest them to have an early dinner, and before going to bed have a glass of haldi milk with a little bit of almond in it, so that there is a good sustained energy but without sugar. So I ask them to eat everything, whatever they like, but in a limited quantity, okay, and have it well timed. Suppose it's a mango season. The major challenge is when it's mango season in India, okay, and none of us want to give up on the mango because it's just there for this 3 months, and people are willing to raise their diabetes to any level. So especially during those time, I tell them, you love mangoes, fine, but eat mangoes as a breakfast in itself, or as a mid morning snack in itself. And during that time, any other food which has high level of sugar, for example, beet has high level of sugar, carrot has a high level of sugar, then avoid that during that season. Then do not take additional halwa. You had mango, so then today don't have, make sure that you don't eat any halwa, or you don't eat any cakes, or you don't eat any chocolates. Then the only sweet in your day that will go is mango. So that's how I ask them to manage their diet. And diets, because I personally deal with a lot of diet, nutritional planning, I change them every week based on their emotion, based on their physical needs, seasonal needs. I plan their diet accordingly. I think his screen has been frozen. Hello?
Yes, no problem. But network is a
Yeah.
main problem to our Sridhar sir. There is no matters will obstruct him, but except the network. Okay, so shall come to Sridhar sir later. Now the person, of course, in the number 2 position, yes, Sridhar, yes, Hariharan sir, in seniority also. Yes, sir, please. You can unmute now, sir.
Okay. Dr. Ahmad Ulda, nice presentation regarding diabetes because Sridhar sir said he is suffering from diabetes. I am also suffering from diabetes last 35 years. I am suffering by diabetic. I am also managing the diabetes, the blood sugar level. I am managing. Today also I examined my fasting blood sugar. It is only 120. Every day I am taking this dates in Malayalam in the days. Every day I am taking. No blood sugar is coming high. So the diabetes is not due to the diet, but with some other reasons. See, you gave stramonium. I think stramonium you gave. Is it so?
Yes,
Patient.
yes.
Actually, stramonium acted well, but when the patient became diabetic years back, there will be some conflicts. So
Yes.
you have to go that days when she became diabetic. There must be some conflicts.
Yes.
If you treat that conflicts now, sometimes it will be cured fantastically.
Yes.
That is what is happening here. See,
So
that is
when we speak about that, obviously I always ask for the starting point of the case, and in this case also I had taken that. Okay, and there was for her the main issue that during that time was the emotional issue. She was actually in the best phase of her life, she said, when the diabetes started. The worst of her life was over and she was enjoying her life. And she said we had gone out and she had consumed something excess, and that's how the diabetes started for her. Okay, that's what she said. So obviously, like I said, the thing for me is right now there is a fire. I need to let this fire go off and then slowly introduce something which will help me for a complete removal of it. So this patient is still with me. Okay, and I'm sure there will be more coming in the case and more progress to the case. It's still not a done deal case. So I sometimes, in initial visit, patients do not reveal very deeper aspect of themselves to you. It develops over a period of time when they develop trust, when they develop that level of faith. So at that moment, how do I get off with the fire is what I think, and I prescribe. And I'm sure if I get into the deeper details and if some other remedy comes up, the game will be very different.
Okay, very correct. Any hereditary aspects, doctor?
Hereditary, yes. Mother was diabetic.
Okay, there lies the point.
Yeah.
See, I am also.
Actually, for her, it is very surprising. Not surprising, actually. She's a very lucky female because she has the most doting and most loving husband. Like if she will say it's sunset and it is sunrise, husband will say, yes, it is sunset. He will not defy her, And it's not that she's dominating, but she's actually very childish. And the husband loves pampering her. And her kids also, sons also love pampering her. So it's a very different dynamics for her. It's like she's always been taken care of like a baby by her husband and her kids. So in a way, emotionally, she's at a very lucky space, but I'm sure there is some things that still she has not revealed to me. And there is more things deep down, which eventually, when she has gained that faith and that trust in me, she will, and that will help us to never take her back to this level where she needs insulin. For now, the biggest thing is that her insulin is stopped She's come back to oral hypoglycemic and she's maintaining her HbA1c to 5, which for me as of now is a good achievement.
Yes.
Okay. Okay. Very good, doctor. Very good. See, a lot of our homeopaths and allopaths are not considering their mind. We
Yes.
homeopaths are not considering the physical symptoms. In certain cases,
Yes.
Yes, sir.
the mother tincture help us to reduce the sugar level. See, it is not in diabetic, not only the diabetic, but even asthma is also like this.
Yes,
Yes.
A
sir.
lot of tinctures we have. See,
Okay,
by
sir. Yes.
okay.
Anyway, there are a couple of questions in the chat box. Then, if there is sufficient time, we'll come to you later, sir. The question in the chat box, the first one is, any tincture for underdeveloped testis? The first question.
Okay, this is the same question which I answered first, that diabetes equal to so and so, not available. But if you have to ask me, undeveloped testis, so there is this remedy in our Materia Medica, Sarsaparilla mother tincture. Sorry, Sabal mother tincture, not Sarsaparilla. Sabal mother tincture, which is a known mother tincture for any underdeveloped sexual organ. Okay, like I remember one case I had of a female who somehow, it was a very prime age of hers, but she was not developing her mame very nicely. And this case was not with me, but it was with Dr. Sunirmal Salkar, and he had prescribed Sabal Ceruleta in that case, and that had helped the patient very well. So that time he had explained us that any time in a given case where you see a lack of development of sexual organs, you can think of Sabal Ceruleta as the remedy.
Okay, there is a good information. There is another question. I got a patient, age 83 years, female, hypertension, thyroid, constipated, TSH 36, complaint of burning sensation in abdomen, itching all over the body with burning sensation, suggest medicine.
That will be a little difficult. We'll need more information about the development, the pathophysiological state, and then we can think of what remedies are possible.
Yes, okay. There's another question, tincture for hyperthyroidism. Yeah.
Tincture for,
Hyperthyroidism. Yes.
again, you're asking like tincture for asthma, tincture for diabetes. Like I said, no one, if you do that, you're practicing allopathy. That's not the way. Yes, you have to ask what are the different approaches in hypothyroid, which in itself is a huge topic, which, I don't have that much time right now that we will be able to cover. But in thyroid,
Yes.
there are certain organ-specific remedies which we can give, and they do help. Like I most often use thyroid dinum as a remedy in itself. Sometimes you use TSH 30 as a remedy. But again, each of these remedy has its own indication. So, and on that basis, you have to give. Then iodine itself, Kali iode is a remedy. So all of these ficus vesiculus there is one more remedy known as ficus vesiculus. Okay. Now again, in all of these remedies, you'll have to differentiate, understand where the patient is, and then give the remedy. We can maybe next time cover this topic of thyroid if we get time.
Yes, of course. And our Sridhar Gupta sir is back again. Sir, you can unmute now, sir. Sir, please unmute. Sridhar Gupta sir.
Somebody was asking that regarding the undevelopment of the testis. Recently, I got a case from Delhi, a 24 years boy. He was not having musters or beards or secondary sexual character, and his penis and testis was not developed. That I prescribed that to the pituitary gland. You read that it is one of the best medicine. Then undescended testis also you may get usually. They are the thyroidinum and medorinum are the medicine I got good result. That I like to share. That is why I raised the hand. Thank you. If
Somebody just asked, na, there was a case, I think, thyroid, diabetes, hypertension. Again, in such cases, like how Sridharan sir said, anterior pituitary and posterior pituitary in itself as a remedy when indicated. If they have the proper indication, these remedies also help.
Yes, definitely a lot of garnering is needed because information is pouring in day to day. A lot of medicinal plants are there in different parts of the world. So all these things has to be added in the materia medica. Proper studies is needed and proper this arrangement is needed to develop homeopathy substantially, because we all know that the possibility of the therapeutic tool, there are no other medicines has got that much of medicines, proved medicines and quality medicines, scientifically prepared medicines. Because in Ayurveda, we all know that the different textbooks are there, then definitely the medicines will change. The preparation will change. Then according to certain topographical differences, medicine can be changed. Then the other one, the generic medicine, the brand medicines are there. But in homeopathy, it's a pure system of medicine. So that will dominate the coming days. Hariharan sir, what is your doubt, sir? Please.
Sir, hello.
Yeah. Yes,
Doctor,
please. Sir.
have you heard of one medicine, alloxane? ALLOXANE.
Yes, it's a very good remedy in cases of acute renal failures. Especially people have used this allopathic medicine for a prolonged time. Alloxane as an allopathic remedy, when it's used for a long time and it has created toxicity. It is, you get a little bit picture of natrum urine that, along with the toxicity of this remedy. Then you give alloxane.
Okay, recommended 3x. Recommended 3x.
Yes.
Okay.
Is it okay, sir?
Okay, sir. Okay.
Yes, that is most important, because Hariharan sir is always happy and contented. That's the most important thing. That is why he is managing the fourth decade with diabetes. That will be an important thing. Anyway, the medicine you mentioned about this bryonia is closely run. Just Dr. This Sadaf made about account that is run. It is closely related to bryonia. It's a very important observation and information to all those who participated. A nice presentation, a nice topic, and it's time to wind up the session. May I invite, and of course, Hariharan sir. Yes, sir. Please, for word of thanks.
Okay, doctor. I like to thank you. See, your class is nice and wonderful, very intelligent. See, schematic, and it will be good for all of us. I am thanking you on behalf of IFPH and the well-wishers of homeopathy. Come again, doctor. See, I like to say one doctor asked for itching for diabetes. That Dolichos is the medicine. Dolichos. I suggested Dolichos is the best medicine for itching due to diabetes. Okay, thank you very much.
Well, we must thank to Samuel Hahnemann to make all these substances into valuable therapeutic tools or medicine through the potentization process as well as the minimum dose. Without these potentization as well as the minimum dose, then again an addition is that the individual symptoms, the characteristic symptoms, homeopathy is not at all possible, not at all conceivable. So that is the highlight to homeopathy. That makes, apart from the nature's law, homeopathy is a separate system. So no compromise on that. With that remarks, let me conclude today's English session. Hope you to meet the same time tomorrow. Till then, goodbye. And it is all Dr. Tanesh for continuation of program in Malayalam.